And I'd like to read a quote from the FAA's mental fitness page that I feel is a source of anxiety for a lot of pilots. It reads, quote, several U.S. airlines already have reporting and monitoring programs that provide the pilot with a path to report their condition, be treated for it, and return to the cockpit once the FAA has determined, through a rigorous evaluation, it is safe to do so. Um, for those who receive a diagnosis during their tenure as a pilot, that might seem like a death sentence for most pilots to report their mental illness and to wait for the FAA to say that they can fly again. How can the industry encourage them to self-report despite that risk? And that can be for anybody in the room, please.
I can start off. I think one of the most important things, especially these young aviators, is to give them some testimonies, give them some examples, some real pilots that have struggled themselves in the past, have gotten the help they needed, and as a result are healthier than ever and back on the flight line. Again, without those testimonies and seeing real people that have gone through this, it is very difficult to have that conversation with an aspiring pilot. Also, we know that it does take time. It does take time to successfully go through that process. And when you're only 18 years old, 6 months to a year seems like a significant part of their life. So again, trying to reiterate that message that taking care of yourself is first and foremost the important thing to do, and then work through that process with them. But the more we can hear success stories that have happened with current pilots, the more impactful that's going to be.
That's a wonderful idea, and I think a really good one. And another one is dispelling misconceptions as well. I will be honest with you, 6 years in the airline industry, and until I joined the pilot peer support program, and more specifically for my carrier at the Pilot Assistant Network, years before I even, as a volunteer, learned about what the actual processes and resources are. And I think what happens often is we hear about one or two instances that turned unfortunately bad for the pilot, and then that becomes the focus point, as opposed to understanding that a vast majority of cases where somebody seeks medical or mental health assistance doesn't necessarily escalate to jeopardy of their career, their license, but we tend to kind of gravitate towards those bad stories and not understand that through education, through testimonies and other such examples, we can understand that no, first and foremost, your mental health is the most important thing, and that it doesn't always necessarily need to be that dire. Like I said, the majority of calls we receive are normally just your day-to-day human being frustration, struggles, anxieties, stressors. So that's, yeah, a really great idea.